Okay, well, hello everyone. Thank you for being here. My name is Jen Bentley, and I'm the Alumni Engagement Officer for the Faculty of Health. I'd like to begin today by acknowledging that much of the work of the University of Waterloo takes place on the traditional territory of the neutral Anishinaabe and Haudenosaunee peoples. Our main campus is situated on the Haldeman Tract, the land granted to the Six Nations that includes 6 miles on each side of the Grand River. Our active work toward reconciliation takes place across our campuses through research, learning, teaching, and community building, and is centralized within the Office of Indigenous Relations. Here in the Faculty of Health, we are fortunate to have Indigenous Knowledge Keeper Elder Henry with us to support us in our learning and creating many opportunities for us to come together as a community. I'm excited to welcome you to our alumni office hours today, featuring Dr. Jade Agonia. Bringing alumni back to connect with our students is an important priority for both the Faculty of Health and the broader university. Alumni help show students what's possible. The success they've had and the stories they share help to shine a light on the path for students who might be wondering what their own futures might look like. We host these alumni office hour sessions every term. If you do have requests for other careers that you'd like to see or hear from, I'd love for you to share your ideas in the chat, or you can always connect with me by email, and I'll share that in the chat a little bit later. In order to make the most of this small group session, and because it's always nicer to talk to friendly faces, I would like to invite everyone to turn their cameras on. I know some of you started with them on and then turned them off, so I will ask you to turn them back on just so that Jade isn't talking to a bunch of black squares today. So for those of you who don't mind, please turn your cameras on, and that way we can have a more interesting conversation for Jade to answer questions when you have them. So if you are able to, please go ahead and turn your cameras on. If not now, definitely during the Q&A, I will remind everyone again. So to get started, I'd love to get some introductions from everyone we have in the group. If people don't mind, I'd love to, let people unmute their mic and introduce yourselves. So I'm going to call on those of you who are here. I love to see so many cameras turning on, so thank you everyone for doing that. So we'll start with some introductions. We'll go through all of the students first, and then we'll end with Jade, and then you can go into your story to share with us. So as I mentioned, my name is Jen Bentley. I'm the Alumni Engagement Officer for the Faculty of Health. And I'm just going to call on some names here. So William, would you like to go first? You can say your name, what program and term you're in, and then maybe what brought you to the session today.
Hi, how are you guys today?
Good, thanks.
My name is William. I'm a second year in kinesiology right now. What brought me here is because I've always thought about wanting to be a chiropractor. I think it's such a cool profession. I get chiropractic treatment myself, so I'm always talking to my own chiropractor, and he's really kind of sparked an interest in me for this profession.
Awesome, thanks. And Adam, would you like to go next?
Yeah, my name's Adam. I'm second year in kin as well, and I came here because like chiropractic is like kind of interesting to me and potentially like a future career. I just find it really interesting, and I spent a lot of time in a clinic, and I think it's pretty cool.
Awesome. Paulo?
How are you guys? My name is Paulo. I'm currently in my 3B, and I'm also in the kinesiology program. And I think since my first year, I've always wanted to go into chiropractic. And when I saw this on Learn, I was very, very interested, and I'm looking forward to asking questions.
Great. Get those questions ready. Shaughnessy?
Hi, my name is Shaughnessy. I'm interested in chiropractic and applying to chiropractic this year. And so I was excited to hear more about what Jade has to say in her experience. Yeah, and I'm in 4B kinesiology.
Great. I'm sorry if I pronounce this incorrectly. Is it Kaya? Or do you pronounce the J?
No, you're good. It's Kaya.
Okay, great.
Yep, I'm in second year kinesiology as well, and just keeping my options open. Not too sure if I'm going to go chiropractor or physio, but just good to join on a call and get some more info.
Perfect. Thank you. David?
Hi, my name is David, and I'm in my kinesiology 2A, and I was interested in participating in this so I could see whether I wanted to do chiropractic or physiotherapy.
Cool. Thank you. Taylor? Oh, your mic's not working. This happened to you last time, didn't it? Okay, we'll keep going and if you can try again if you want. Krunal?
Hey guys, my name is Kunal. I'm also in my fourth year term of kinesiology, and yeah, I'm just debating right now. I've been applying to CMCC and also a couple of physio schools in here, and I'm just trying to compare which one I should really go into more so in the future. So,
Great, thanks. Michael said in the chat that he's driving, so we won't ask him for an intro just yet. Michael, you can put it in the chat when you get to your destination if you'd like. And Ronnie, are you able to give an introduction?
Yeah, sure. Hi, I'm Ronnie, and I'm in my hobby kinesiology. And yeah, I'm looking forward to physiotherapy or chiropractor too.
Great. Thanks for joining. Okay, and with that, I will hand things over to Jade and let you introduce yourself and share your story from Waterloo to where you are now with everyone.
All right, awesome. Yeah, thanks for turning your mics on. I was worried I was going to be talking to just black squares, so I really appreciate seeing faces. Yeah, so my name is Jade Agonia. I'm a chiropractor and co-owner of The Movement Lab. The Movement Lab is a facility where we do physical therapy and rehab, rehabilitations. We have chiropractic, massage therapy, athletic therapy, kinesiology. We used to have a physiotherapist, but he had to move on, which is fine. We've also hired a little bit more, interestingly enough, more athletic therapists than anything. And then we also have the performance area where we have coaches for strength and conditioning and more for high performance elite athletes. We work alongside mostly amateur, but also some professional athletes, mostly with Canada Basketball. My business partner is the head athletic therapist of the men's basketball team. So during off season, they'll come home, mostly the Canadians, basically. They'll come home and they would do some off season training with our coaches and then get some, treatments with the therapist as well for any lingering injuries they might have, and then also get some nutritional guidance with our coaches and things like that. But we also treat general population, but we do lean our clientele and our patient base to lean more towards the more active individuals. So in terms of my journey, I did a kin co-op program as well in Waterloo. I graduated in 2009, which seems like forever ago. My interest in kinesiology really started out more in like grade 12 high school. I had one of my favorite teachers was my phys ed teacher, and he was going to be teaching that course or that class. So I decided to take it, and I really, really liked it. Like anatomy is one of my favorite topics and subjects, also biomechanics. And it really opened my mind in terms of the body mechanics and biomechanics part of it. It really opened my mind on how the body worked as a whole. Not one body part or not one muscle works in isolation. Everything has a connection to it, and you can really draw the connection from your wrist to your hip when you're doing a baseball swing. So that really kind of opened my mind and really got me interested into kinesiology. So when I was looking at kinesiology programs, I know Waterloo is one of the most respected one, and I was really interested in the co-op program because I was one of those person. I'm more of a hands-on person, and in terms of learning, so I was really interested in the co-op program, and really helped me in terms of deciding for chiropractic because it was my second co-op job I was with sports chiropractic. He had a practice in Mississauga, so he had his clinic there, and I live in Mississauga, so it kind of helped because I can stay at home and go to work. And he had his own practice, and so he also volunteered as a hockey coach, which was really cool because sometimes I would join him when he coaches hockey. It was midget hockey that he coached. And my job was mostly receptionist kind of job, answering phone calls, booking patients, taking payments. But from time to time, I would shadow him in his treatments. So it's really cool to see his assessments, really cool to see his treatments, and really how he could get these athletes better and get them back into playing. And also, I really learned the business side of it as well, and looking into eventually why I decided to get into chiropractic. I like the lifestyle that it kind of brings together. I mean, it's a lot of work in the beginning, a lot of work in the beginning, and still working hard. But again, if you love what you do, like, it's not really work. And if you're with great people, and I have a great team with me, it really makes everything better. So, but I like the fact that he was his own boss, and I really wanted that. I wanted to have my own clinic. I wanted to set my own hours, and things like that. So that part of it is something that I was really interested at, and why I really wanted to really look into it more seriously. So yeah, that was, and I graduated in Waterloo 2009. And I worked as a kinesiologist for a bit, but honestly, at that time, it wasn't a registered kind of entity what it is now. So it was really, I was working as a what do you call this, like an assistant. I worked as an assistant in physio or the chiro, doing stretches mostly, and I didn't really enjoy it, and it was started really looking into applying for chiropractic school. So I applied to chiro school in 2010, and Dr. Sawa was actually the chiropractor I worked for in co-op, and that's the one thing I'll say. I think most of you guys are in co-op. Really hold on to those networks, hold on to their contact info and everything like that, because you never know when you're gonna need them. Great thing was that, like, Dr. Sawa was in Mississauga, and I knew where the clinic was. It was kind of easy for me to kind of go back to him and, like, I'm interested in chiropractic, because I have to say, I'm not sure I believe it's still the same in terms of for people who are interested in getting to chiro school. I believe you still need a letter or some sort of referral letter. So he was my referral letter. So that helped out a lot. And got into chiropractic school in CMCC. I went to, as I think most of you guys know, Canadian Memorial Chiropractic College in North York. Graduated in 2014. And then I pretty much started working right away, same year, around September. I think I took a few months off to kind of have a little bit of a vacation. But yeah, pretty much went straight on in 2015 and has been working since then. And I thought about, because with Dr. Sawa, he was a sports resident. And I don't know if any one of you guys here are interested, there's a thing called sports residency or clinic residency or radiology residency after, if you go to CMCC for chiropractic, which is basically 2 more years added onto the 4 years of chiro school, where you kind of do a little bit more. It's kind of like grad school in a way, for Chiro School. So and I was interested in the sports residency because that was really something I was interested in. I wanted to kind of do similar things and treat athletes and things like that. But it was more my own choice to not do it because at the time, Chiro School is a lot of money, a lot of, I also had student loans for Waterloo. Co-op helped for a little bit. Getting paid in co-op helped a little bit, but it was stacking up, and it was my personal choice to not do the residency and rather just go straight to working. Also, I did, and anyone who is interested in it, like, do your own research. So for me, I did my own research. I spoke to other students that was currently in the residency program, and again, it was just my own personal choice to just start working and in a way just do work as a chiropractor, but leaning more towards and getting to know more coaches and other therapists and the sports field, in the sports arena, really. But yeah, so after chiropractic and everything, I really wanted to start working, start going out there. I was hustling, I was working. There was a point, and I think around 2015, my dad lost his job, got laid off. So I was still living at home. So I kind of started to have to help out, pay the mortgage and things like that. So at one point I was working 7 days, which I don't recommend. Don't do that. I think at that point I was also young and hungry and, just really wanted to get out there. But yeah, no, I don't recommend that. But the one thing I do remember by working in a lot of clinics, I think I counted, I worked about in 7 different clinics in the beginning. And when you're new, when you're freshly graduated, everybody wants to hire you because you're cheap labor in a way, right? They can kind of pay you in the very low end. But at that point, I just also wanted to get my hands really practiced, odd thing to say, but to touch a lot of people and really get your hands comfortable with treatment, get your hands to really learn how to observe the body in a way. So, but the one thing that I didn't like by working in so many different clinics is I felt like I was treating differently in every clinic. In this clinic, I treated the way other chiropractors treated in that clinic, and another one I treated differently. And throughout this whole time in the beginning, I was also doing a lot of continuing ed courses. I was doing a lot of CE courses where I feel like I wanted to practice the way I was learning because there was more recent studies or recent therapies at the time. I also did more of a biomedical acupuncture, and I wanted to start using acupuncture in my treatments, and the clinics were like, no, we don't do that. So I was like, okay. So I really started looking into how I can practice the way I want to practice. And that's really when I really started looking into, in the beginning, I was just looking into having a room to rent and, start having my own business, having my own patients, things like that, which was really interesting because I ended up meeting my now business partner, Chris John, who again, I said is the athletic therapist. And we met so randomly in I wanted to learn, I don't know anything about business. So I went to a business 101 seminar in the public Mississauga library. It was free. I was like, okay, I'm going to try it out. And I met him there randomly. He was just there too. He had a Canada basketball shirt on. So I'm like, oh, he probably works with the organization. I should get to know him after. So after the seminar, started talking to him. I found out he's an athletic therapist. And he was kind of on the same boat. He was frustrated that the clinic he was working, well, actually he worked in a gym. He rents a room in a gym. And he was frustrated, and we were both kind of it was odd that it was so a random seminar that we met, because now he's like my big brother now. It's really odd. But again, the power of networking, it's really cool. you never know who you'll end up working with in the future. So, but yeah, we kind of just kept talking and kept talking. We would randomly just meet in like coffee places and start thinking like how we want our own place to be. And I think around 2016 is when we started, okay, let's do this. So we started our first, before the Movement Lab, there was actually another business that we did called Funk Monk, which is short for functional monks, because we really thought of how to look at the body holistically, not just physically, but also mentally. And you know, once you get into the business, you realize some of these pains that they're having, that people are having, a lot of that also linked to how they're feeling at the moment. And you'll know that if someone's depressed, they have their pain tolerance is way, not pain tolerance, so their pain intensity is way higher than the normal pain. So, and those are the kind of things is like, oh, okay, it's a full holistic look into the body and how to treat it, excuse me. So what we did, it was me, him, and we hired a massage therapist. So just the three of us, and we rented rooms in different gyms, and we had 3 different locations. So we were in Mississauga here, we worked in a CrossFit gym. We were in like Brampton, Vaughan area. We worked there, and that was more of a high performance basketball gym. And then we also worked in Oakville, which is again, kind of similar high performance gym, but it was more catered towards hockey players, soccer players, and fitness models. So, and then we kind of just, we did that for like 2-3 years. And then one of our patients who was a Taekwondo instructor, he like told us about this unit that's available in the plaza where his school is. And he was like, there's a unit available. If you guys want your own place, you should check it out. And that's really, and that became the Movement Lab. And interestingly enough, that Taekwondo instructor and his wife ended up being our business partners in the beginning, because again, Chris and I, we both still have student loans and not have the best financial record. So we needed help, and they've been at Taekwondo school, they've been in business for 10 years. So it was great for me because I wanted to learn also that part of the business, right? So they helped us out in 2018, September 2018 was when we opened the Movement Lab. So, and yeah, and it was great to kind of do it that way. At least it worked out for us, because while we were renting rooms in different gyms, we were building our clientele. So by the time we opened our own place, we weren't like starting from zero. We already had our own place. If anything, our patients liked it more because we were just in one place rather than 3 different locations. Because sometimes they'll get confused and they think their appointment's in Mississauga, but we're actually in Brampton that day. So that got confusing. But yeah, no, and yeah, we've been open since. A little, you know, hiccup with COVID and all, but it's fine. That was also, I mean, I can do a whole 3-hour talk on what we had to do for COVID, but that's again another time for another time probably. But yeah, that's basically how the Movement Lab kind of happened.
Awesome. Thank you for sharing all of that with us. It's I mean, I think hopefully it's interesting to all the students here to see, like, you know, what kind of it took for you to get where you are at starting your own business as well. But yeah, so what we'll do now is open up for questions from anyone. So I would love if people would use the raise hand feature under reactions if you have a question. I know there's a few of you who are maybe not able to join on camera. So if you really can't join live to ask your question, you can put it in the chat and I will watch for those as well. But I'd encourage everyone to unmic and ask their questions to Jade, and we'll continue the conversation. So don't all raise your hands at once, but hopefully somebody would like to start off with a question.
Oh, there.
Perfect. Mike. Mike put his intro in the chat also, Jade,
Okay.
and is a fourth year kin student. So Mike, go ahead.
Hi, everyone. Jade, thanks for your time, first off. But I noticed in the little blurb about the session today that you also studied acupuncture. And I was wondering what led you to that? And was that at chiropractic college or was that separate from that?
Okay.
If we talk about that, that'd be awesome. Thank you.
Yeah, so that was so the last year of chiropractic school is internship. So it's just clinic internship. You have some, you know, there was a business class and an ethics class within it, but it was mostly like you're working in a clinic. And I've always had interest in acupuncture. I had acupuncture done once when I got into a car accident and everything, and it really helped me. But what was interesting, I guess, there's two different types of acupuncture, really. There's the traditional Chinese medicine acupuncture, and then there's more of what we call like Western acupuncture, biomedical acupuncture. And that's more of how I train, because the traditional Chinese medical acupuncture, that's a 4-year course. And it's really, and acupuncture is just one of the things that you learn to be a practitioner, TCM practitioner. So the course that I did is outside of CMCC, but my teacher was actually my clinic intern teacher, my clinician in my internship. So there's another program that most chiropractors do, which is in McMaster, which is a biomedical, I believe. It might have changed the name of the program, but it's also like a biomedical acupuncture program. And then there's quite a few popping up now, but when I was doing it, it was mostly the course was being done in CMCC with, again, my clinician, but and then there's another, it's outside of CMCC, though it's not part of Chiro program. And then again, there's the one in McMaster. Did that answer your question? Yeah, okay, cool. Yeah.
Thank you.
Yeah, you're welcome. Anybody out there? Oh,
Okay, we'll go to Paolo first and then William second.
I don't know if my mic is unmuted right now. Can you?
Yeah.
Okay.
Yeah.
Okay. I was just curious about the application process to like CMCC and like your like best piece of advice and when applying. Like, is it focusing on grades? Is it focusing on trying to get like a really good like co-op position? And then like I'm kind of just curious with that.
right. Okay, so I probably should have asked someone who's like more recent, because I have a feeling it's changed now, especially after COVID. Because when I did it, you have to do an essay, right? And the essay I did and redid many times, and I had so many people, you know, just read through it and see if I need to change any. And then I think it's best if you have some sort of like experience in a clinic, most specifically with a chiropractor. I think one of my main things was the fact that I did ask Dr. Sawa to be my referral, because Dr. Sawa is pretty, like, he's one of the first few people that did the sports residency. Like, he was one, so he's known in the sports residency program in CMCC in particular. Like, he used to teach in the college too, so he's known that way. And I remember my interview as well. I just remembered, I remember when they asked the question and I answered the fact that I did a co-op job in a clinic. Like, I kind of saw them all smiling. So for me, like, okay, they really like that answer. So try to get some experience in a clinic per se, you know, and I think I guess the one thing I forgot to mention was because I was really during I don't know if it's the same, but like the first year you don't really have a job placement, right? Is that still the same? I'm not sure. But that summer, I actually ended up working in a soccer facility as an assistant to a kin. And the clinic was actually by a chiropractor. So and honestly, I got that job so randomly because I literally just emailed. I just kept emailing people. Like the worst thing you can get is a no. So I literally just kept emailing, and then sometimes I don't get an answer. And then there was like the OSA, Ontario Soccer Association, and I have no experience. I have nothing. So like they just like, hey, if you want to come, you can come at this time whenever the kin's there. You can help the kin. Because he was by himself and he had like 2-3 different people that he's like working out at the time. And they even paid me. I wasn't expecting to get paid, but they even paid me for that. So I would just do that, like just email, just call, see if they can. And we've done that in our clinic as well. Like right now, there's a few people that shadow me, actually, like first, like chiropractors that just graduated, because they had to do internship during COVID, which is interesting because like I think half of the time it was like this. It was through Zoom, and they're just basically talking to the patient and not really treating, which is unfortunate because really that's how you get good, is when you practice. So yeah, that's my advice on that. Just really show that you did your research. You did really look into chiropractic. That good?
Okay, William, you can go ahead.
Hi, Jade. Just
Hi.
branching off Paolo's question. I was just wondering, when applying to CMCC during the interview process, like what kind of questions did they ask you? And also when applying, like what were your grades looking like, I guess?
It's a good question. I mean, I was an okay student. I think, well, you know what? At that time too, I think the one thing I did was like my lowest marks were like organic chemistry. And part of me is like, I don't even know why I did that course because I didn't really need it. But like, anyways, just I think my grades were okay. I don't remember exactly what my GPA was, but like it was in the high 80s, I'd say. But in terms of the questions for the interview, there were quite a few situational questions from what I remember. Again, that was when I did it. It may have changed now. But it was there was a lot of like, oh, why do you think, kind of like your typical interview questions. So why do you think you'll be a good chiropractor? What was your interest? And it was a pretty standard interview, to be honest. I think I remember the one thing that kind of threw me in the loop was they asked me a situational kind of interview of like, I still remember this. This is the one that really kind of stumped me at the time, was like, tell us a time or a situation where you had to deal with kind of like a, oh my gosh, what do you call that? You had to deal with not fraud, but something like that. They asked something, it was really odd. It was like, how did you like, and I had to talk about my experience of being a receptionist and how someone wanted to change their receipt. And I'm like, oh, I can't do that. Like that was my explanation to it. It was a really interesting question. And I don't know if it's just something that like they had to, the chiropractic profession was dealing with a lot at the time. But yeah, that was an interesting one. But there was a lot of situational and kind of behavioral questions, I'll say. Pretty standard one. So yeah, just have questions, like answers ready for those kinds of things.
So it was like an ethical judgment type
Yeah.
question.
That's pretty much, where you had to kind of really think about it. And it took me a while to come up with that answer too, because I wasn't expecting that question. Yeah.
Okay, does anyone else have a question? Okay, well, we can, some question. Oh, Paulo's got another question.
Oh, I see another hand up. Oh, there's a hand.
Yeah, sorry, I just wanted to ask again on I guess this is more of a personal question, but like what do you think was the biggest difference from like your undergrad experience taking like kinesiology and like all those undergrad classes to that transition to CMCC? Like I know the course load was probably way heavier and the content was probably a little bit harder.
Right.
But like was there a change in like the way you studied? Was there a change in like okay, like I can do this more effectively, or like what do you think was the biggest difference like in your experience between CMCC and Waterloo?
Ooh. I would say, well, like I remember the first year of CMCC was basically a review of the kin course, like the from everything from anatomy to biomechanics and stuff like that. It was like the first year of kin was, yeah, a review of the kin program basically. But oh man, the one thing I'll say, I ended up really leaning towards my classmates. Now, I mean, you know, it was a lot of group learning for me that helped. Now, and everybody has their own kind of way of learning, but you know, it was definitely more loaded. Like it was heavy courses, right? Because like Waterloo, you'll get like 1 or 2 classes and you're done for the day. This one was different, especially second year was definitely one of the harder courses, harder years, just because that's when you do a lot of the microbiology and pharmacology and the what else was there? The biochemistry, like things like that. Like I didn't like those. I like anatomy. I like things that I can see, and you know, I didn't want to histology as well. Like some of those courses were really tough for me because a lot of them we were also just like wondering why we need to do it for chiropractic, and that a lot of that is because you are called a doctor, so that's why you have to go through all those sciences compared to physiotherapy, because like we were doing things with a microscope, and a lot of us were like, why are we why do we, you don't see a chiropractor with a microscope, right? But it is part of it, because a lot of what I've known now looking back to it, a lot of what they did with the Chiro program and the courses we learned was really preparing you for the board exam. Because the board, like, and I did both Canadian and American board exams. American board exam is way easier. The Canadian one was different. Like American board exams was like, what's this bone? It was like a femur, you know, like it was really easy. Canadian board exams were all clinical based questions. Like there's one case and you get 10 questions from that case, and you don't know what question, if you don't know whether you're getting a microbiology question to a histology to a pharmacology to anatomy questions. Like it was really, it was pretty intense. And so, and that's where you kind of like at the time, you know, I'm kind of begrudgingly like, why are we learning this? But it does help prepare you for the board exams, which is the main thing in the end, really, to get licensed, right? So yeah, a lot of group learning for me, a lot of like the libraries, probably you'll always see people in the library. The one thing that my class, at least my year, was really good at, we all like shared notes. I've heard of other years like being more competitive and like, no, this is my notes kind of thing. But my year was really good. We like shared notes. We like we have, I think at the time, it sounds so old, but Facebook was a thing where we would share, like Facebook for me was about school, right? Even in Waterloo, like we would create groups and we would share notes through that way, and make we'll just do random like study sessions. And unless you're on it, one thing I'll say is you just want to keep up with it. Just like anything, you don't want to procrastinate it because it's hard. Once you kind of miss one thing, you have to keep up, or it's hard because it is a lot of material. But also I would say don't kill yourself over it. Like it's almost better to really understand the material than memorize it. There were definitely some memorization on my part, especially biochemistry. But it's in the end, you kind of, I hate to say this, but in the end, unless you're going for residency, in the end, you really only have to pass. But because you want to be better more, and like things you want to focus more is like diagnosis or treatment technique, how to do the adjustments, stuff like that, like things that you would actually use as a chiropractor. Like, don't kill yourself on biochemistry the way I really hated that course, but the way I did, like, because in the end, you just really needed to pass, unless you're going for some sort of honor roll. Because if you ask me anything I learned in those courses, I don't remember much, to be honest. But I remember technique. I remember practicing, doing like exercise rehab was one of my, I like that course. And diagnosis was really interesting to me, like trying to figure out like what the person has and, stuff like that. So hope that helps.
Thanks. Kaya, did you have a question? And then David, we can go to you next.
Yeah, you're mentioning starting up your own business. It was a little bit difficult for the financial part. Looking back in your undergrad, would you have chosen more business electives? Or if you could go back, what would you change that you took?
Oh, that's a good one. Business elective. Maybe. It's hard to kind of tell because I don't really even know what business courses if I were gonna take some. The one thing I'll say though is like get yourself a really good accountant. Get yourself a really good accountant that you trust and a good financial advisor to help you out with that, because those are the two people like now I treat them for free because like they helped me so much, like in terms of what I needed to know about finances and just if anything, if I'll take anything, it'll be more like in terms of financial literacy, like how to get rid of debt, how to invest, things like that, more than business. Because business, a lot of what I found is, especially for healthcare, it's so different from any other business, maybe in other services, but you have to deal with insurances, which I found so difficult to, and every year there's some sort of weird insurance program that like now they require more to get their benefits back for a chiropractor, massage therapy. Like it's kind of annoying. So it's the way we deal with that in our clinic is like we actually don't do direct billing to insurances. We're kind of in a way like, hey, you pay us and we'll send you whatever receipt you want. But you deal with your insurance, to be honest, because it changes almost like every month on like what's required, so you almost, in that sense, you almost like really learn as you go along. Again, I would rely on people that know more about that stuff than me trying to research it, because it'll take longer. And I just, I'd rather focus on the things I'm good at, and things I'm not good at, I delegate to people I trust. That's probably the best thing I can say about that. And the one thing I really, especially when COVID happened, like it helped a lot being in a team. Like, I mean, I don't know how I would have dealt with COVID by myself if I was a sole business owner. It was really tough. It was a lot of stuff that we kind of had to deal with. And it seems like forever ago, but We had like a change of ownership. I talked about those two, the Taekwondo couple that was a business with us, went in business with us. Like when COVID started, they wanted out and we had to buy their shares and we had to figure that out. And we were closed. We weren't, our clinic was closed, right? We weren't open. So it was a lot of that, like it was a lot of stress. But glad we got through it. And yeah, I would just, again, like I said, I would, if anything, like doing things like this, networking, finding people that you trust, that understands who you are, what you do, and what your goals are financially, where you want your future to be. Like my accountant knows exactly what I want to do in 5 years, and he kind of creates a plan for me. So, and I just follow his plans because I trust him. Same thing with my financial advisor. I didn't know anything about investing. So that was a new thing for me to learn. And he really taught me on how to do that. So yeah, just really get to know people you trust.
Thanks. David, you can go ahead with your question.
My question was, I actually had two, but I'll ask the first one first. What part of your studying period do you value the most, like the theoretical knowledge that you gained, or more so all of like the practical experience that you gained like throughout the years of like pretty much everything that you did?
I mean, you kind of you have to have, let's say, you have to have the theoretical knowledge, right? You have to know the anatomy and the orthopedic sides of it, like how to do testing and stuff. But like you can't really have one without the other, because it was for me, the way that I learned, I'm a very practical, like tactical person. I have to experience, have to touch. Like I actually did, I TA'd for the KIN 100 lab, because I really, that's how I really studied. I studied more, or I remembered more when I was like touching the muscles and things like that. And that's how I make it permanent in my head. And that's just me in terms of my self-awareness. I know I need to do that rather than just reading in the book and memorizing. Same thing in terms of like even treatment now. I mean, as much as I hated working a lot in the beginning, it really did help me with treatment, because it really gave me the practice that I need to treat people in terms of adjusting different body sizes, right? Different injuries. And you kind of end up becoming your own, you have to really be creative sometimes, because sometimes the tables, I don't know, I'm 5'2", so I'm pretty short. So treating a basketball player is really interesting. Sometimes I get them on the floor as I can't, you're too tall, you have to like sit down. So I so you just have to be creative in those kinds of situations. And one thing about treating athletes is like they don't care. As long as you treat them, as long as they feel better and they can go back to their sport, that's all they care about. So yeah, I've treated people on the floor. So to kind of make it permanent, and to kind of, you start seeing patterns too, more so when you start then like because you can read about this, you can read like, oh, most common injuries for a basketball player, or most common injuries for a soccer player. But if you actually see it and like touch the knee, touch the ankle, and you kind of, I don't know, like, again, I guess there's more self-awareness in how you remember or learn. But for me, like tactile stuff, I like to like touch, okay, oh, I remember how to treat this kind of ankle. So for me to make it permanent, to make it more memorable, for me, I really enjoy that stuff more than the reading part. Again, it's something you have to do, the reading part. It's a necessary evil kind of thing. But I definitely like the treatment part more. I hope that answered your question.
Yeah, I did. And my second question, I guess this is more of like a personal question. I mean, selfish kind of, but in your opinion, what would be It's just because I'm not sure if I want to do physio or chiropractics yet. So in your opinion, what would be the things from chiropractics that are like superior to like physio or like athletic?
Right. That's an interesting term. No, so okay, I should say this, that like I think more and more now these days that like the differences for physio and chiro is less, because I'm doing a lot of CE courses, like continuing ed courses, where it's not just for chiropractors. Like I see massage therapists in there, I see athletic therapists in there, and physio. And almost it's almost like you kind of go to the more, you're going to a person because you like the way they treat rather than because they're a chiropractor or physio. I think way back then it's a little bit more distinct, the line of like what a physio does and what a chiropractor does. Because there's also physios now that do adjustments, like they'll do a seminar and they can do an adjustment. You know, there's massage therapists now that also can do acupuncture. So it's really blurring the lines. It's almost like everyone can do whatever they want in the way, as long as you get the training for it. In the end, it kind of like more like the designation really maybe is the difference, you know, or if you really want to get into it, it's really more into the benefits and like the insurance of it all, where really the difference happens. But like as a chiropractor, like I put people into exercises as well in the gym, which is again one of the reasons why I wanted my own clinic, is because I wanted to do whatever I need to do to help the person. But I also adjust. I also do acupuncture. You know, I kind of do whatever the client needs, and you know, help them achieve their goal. And I can't speak so much about physio, but for chiropractic, like at least in CMCC, what I really like is they're very evidence-based in CMCC. Like our 4th year, we had to do a research project, right? So in a research paper, I mean, so that was really interesting for me. And I can't talk about physio because I'm not sure about physio. I know, I believe, I don't know if it's happening soon, but from what I'm hearing, it may be a 4-year program now soon. I'm not sure. I think right now it's still a 2-year master's program. Correct me if I'm wrong. Because I think they're trying to go to a similar route the way the Americans are doing it. Because in America, yeah.
I think it's a 2-year. I'm not completely sure, but I think
it's a 2-year. Yeah. So yeah, because I believe in America they're called as the doctor of physical therapy.
Yeah.
But I believe that's a 4-year kind of thing. So I'm not sure, but like but I've always been hearing that, but I don't know if it's happening yet. So I don't know. I hope that answered your question.
No, it did.
Okay. Awesome.
That was a tough one.
Yeah.
Looking at the time, we have time for maybe a couple more questions. We're getting close to 5, but I did put Jade the link to your LinkedIn in the chat for the group in case anybody does want to connect with you.
Yeah. Maybe just like I check my email more often than LinkedIn.
Sure, if you want to put your email in there, go ahead.
Yeah, definitely just reach out. Because if you guys have any more questions or want to visit the clinic or anything like that, that's cool too.
Yeah, because you said that you do take on interns occasionally, or
yeah, we do. Right now we have an athletic therapy intern. So it like helps us in the clinic, you know, can shadow in their treatments and just kind of get to know what we do. Yeah, like we try to at least have 1 intern at a time. There was one time we had like 4 interns, and it was too much because some of them were like just not doing anything, just sitting. So I'm like, oh, we went overboard. But yeah, we like having interns around for sure.
Awesome. If no one else has other questions, there was one question I thought was interesting that was submitted during registration that I'll ask, but it was, what was the biggest challenge you face in the rehabilitation industry? and how does it, no, I'll just leave it at that. So what was the biggest challenge you face?
I think in the beginning, especially when we were funk monk and we didn't have any strength and conditioning side, it was probably the communication with either the coach or the trainer. Because we would do something in treatment and then they would, in a way, if the patient itself didn't communicate properly what we were doing to the coach, they might have just undo what we did, right? And that's that communication was like difficult. It was like, oh, I told like not to do that right now because we're trying to fix this and that. So so when we finally have our own place, the movement lab, having the coaches there was really great, because then the communication was easy. And in a way we would, so the one thing we did as well is we would take CE courses together. So we would have the same kind of knowledge, we would speak the same language almost, that would like, hey, this is what I did to Brian, whatever. And they would know exactly what to do. And I didn't have to kind of explain everything on what they needed to do, because they kind of, again, it's that language and that communication with the coaches. It made it really easy so that we were all in the same kind of page to help the person out. And what we did in the room, the clinic room, didn't get, didn't get worse, but anything if it helped. So that was the one thing in terms of that, why we really wanted a gym side as well in the clinic.
Great. Thank you. That's a great comment that you bring up. I know
Yeah.
as a patient, my massage therapist had to remind me, not to go work out or play sports after my treatment.
Yeah, no, and it's sometimes it's just like, maybe it's also too much for the person to remember. And it's like playing that telephone game where it gets misinterpreted to the coach, and next thing you know, it's like, oh, that's not what I said. It's like, but yeah, so just having the clear line of communication just helps with the continuation of care for sure.
Awesome. With that, I'll do one final call for questions. Shaughnessy wants to jump in with one.
Okay.
This is just a light question. I was curious, what's your favorite part about being a chiropractor, your best experience with it?
Ooh, yeah, no, definitely seeing a person get better was always like the thing that I love the best, is like when they get back and you, again, we're not like advertising a lot of our patients have been more word of mouth. So that's, for me, is like when they refer another person to me, because that means they like my treatment and that's why they're referring another person. So definitely that, like getting them better, seeing that like, oh, I can make a difference in this person's life. I can make them happier because they're not in pain anymore. I can make them healthier. Being like, I would say one of the most kind of one that really touched my heart was that we were treating this couple. She was 68, husband 72, and they would come in because I treated their son, and the son, it's like, hey, I want my parents to see you. It's like, okay, sure. And then I started with like, and it was kind of all just in a way, their pains are more from inactivity. They're just not moving much. So, and then slowly I would like try to introduce them to the gym, and they're like intimidated and all that. It's like, no, we're just gonna walk. And then next thing you know, I was like, oh, we're just gonna squat. They just try to sit, and then, but the next thing you know, like they're deadlifting. Like, who knows a 68-year-old that deadlifts? Like it's kind of like now they're like gym rats in a way. They like hike everywhere. They do yoga. So for me, and she always tags me on Facebook. But for me, like that was really cool to kind of, even for someone that old, I mean, we always think of like athletes, and for me, it's those people that kind of matter more for me, because they didn't even think that they could do that. So that was probably one of the sweetest. Like I always kind of, and whatever event we have, they'll always come, anniversary, things like that. They're like our number one supporters. So we always have a whole contingent of like elderly Polish people coming in. Whether they brought their whole Polish community into our clinic, which is really cool.
That's so great.
Yeah.
Well, thank you so much. With that, I'm going to ask one more favor from the whole group. Taylor, our social media assistant for the kin department, would love a screenshot for us so she can do a recap on the session. So if everyone doesn't mind, I'm going to do a quick screen capture of our group. So either turn your camera on if you want to be in the picture. If you don't, you can jump off, but some smiling faces would be great. And awesome. Ronnie wanted to join in the picture. Love that. Okay, so I'm gonna take it in. Oh, more people joining. I love this. What a great group. I'm so happy. Okay, so smile. 3, 2, 1. Awesome. Let me just make sure that that worked. And everybody's smiling and eyes open. Good work, everybody. Thank you for for doing that. I appreciate it. And with that, thank you, Jade, so much for spending time with us today. I hope all of the students here got lots of great, valuable information from her. I think you shared so much and so many different angles. So thank you so much for spending time sharing your experience, and hopefully helping our students make some decisions and get some successful applications out when the time comes.
Yeah, for sure. Thank you for having me. And again, like yeah, I put my email down in the chat. So if you guys want more, if you have any more questions or anything, just email me.
Great. And then the last thing I will say is that you will get an email in your inbox with a quick survey. Really, it's just choosing an emoji smiley face for whether or not you like today's session, and a little bit of feedback, which is helpful in us creating future events. So please take a moment to fill that out. And otherwise, thank you for being here. And if you have other careers, maybe I need to get another physiotherapist in. We did have somebody in the spring term, and this is it for this fall term, but maybe I'll get another physio in for the winter. I saw 1 thumbs up from David. So if I set that up, I expect you to attend.
Yeah, you could definitely book a spot for me.
Perfect. Okay, well, thanks everyone. I will let you get on with your evening, and yeah, have a great night. And Jade, you can hang on a minute.
Okay.
Thank you, Jade.